The following is an article from Health Magazine, our special sleep edition from summer 2023, published by the Southwest Utah Public Health Foundation. Lock the Clock: Standard Time versus Daylight Saving Time by Eric Sooney, guest columnist. Yes, Daylight Saving Time started again on March 12th and ends on November 5th, 2023. For much of the United States, Daylight Saving Time is a part of our lives again, despite efforts to legislate out the time change. On March 15, 2022, just days after clocks were adjusted to spring forward, the U.S. Senate passed the Sunshine Protection Act, which would abolish clock changes in favor of daylight saving time year-round. By establishing a stable time, the new law would prevent sleep disruptions that occur from biannual clock changes. Switching to permanent daylight saving time, however, could interfere with quality sleep. Groups such as the American Academy of Sleep Medicine, as well as many experts, oppose permanent daylight saving time and prefer the idea of permanent standard time. Daylight saving time reduces exposure to morning sunlight, which makes it harder to wake up in the morning. More light in the evening may make it harder to fall asleep at night. In addition, the shift in the timing of daylight exposure can affect the body's internal clock, which follows a 24-hour schedule known as a circadian rhythm. So is daylight saving time becoming permanent or ending permanently anytime soon? Not necessarily, as the Sunshine Protection Act still requires approval by the House and President Joe Biden. That didn't occur with the 2022 version of the bill. But in March 2023, not long before the clocks changed again, Senator Marco Rubio, Republican from Florida, reintroduced it to the Senate, with a similar bill also introduced in the House. Either bill would bring major shifts in our clocks, daylight exposure, and sleep if it were to become law. A new study by the American Academy of Neurology says that the November time change may be the one that hurts. The analysis of 30,000 Canadian adults found that in the week following the changing of clocks in the fall, people experienced the following: 115.2% increase in difficulty falling asleep, 102.8% increase in excessive daytime tiredness or hypersomnia, 64% increase in difficulty staying asleep, and a 34% increase in sleep dissatisfaction. Although dozens of states have considered legislation to end clock changes, only federal action can establish permanent daylight saving time in the United States. Legislators in some states that would move to permanent daylight saving time, if federal action allows it, are now second-guessing that move. States may be able to opt out of daylight saving time, as Hawaii and most of Arizona already do, choosing permanent standard time. So far, there has been no significant action on the Senate or House bills to make daylight saving time effective year-round. As it stands, daylight saving time will end again on November 5th, 2023. This article was excerpted from Latest Updates: What's Happening with Daylight Savings Time, from www.sleepfoundation.org, used with permission. If listening to this article put you to sleep, you're welcome.